What is nasal saline spray? Most saline nasal sprays contain sterilized water, salt, sodium chloride, sometimes preservatives to give them a longer shelf life. The usual delivery system is a squirt bottle or pump bottle. Saline nasal drops for babies use a dropper. Uses. A number of conditions may be improved with saline nasal spray. These include dry nose, nasal congestion due to a cold or sinus infection, allergies, nosebleed, epistaxis prevention, snoring, postnasal drip. If you use steroid nasal sprays, your healthcare provider may recommend using a saline spray before the steroid. Some people with obstructive sleep apnea may also use saline sprays to reduce nasal congestion when using a CPAP machine. It may rinse out allergens, which can reduce swelling of the nasal passages. This can improve airflow through the nose. That prevents mouth breathing, which may contribute to snoring. Saline nasal spray is saltwater. It can help with dry nasal passages. It's inexpensive and sold over the counter. You can also make your own. It can rinse out allergens and improve airflow. It may be used before steroid nasal sprays to soothe the tissues. Dosage. You can use a saline spray as often as your symptoms require. It can be used daily without potential harm. The effects may be relatively short-lived, requiring multiple uses per day. If it is overused, you may simply notice the excess running out of your nose. Modifications. Saline nasal spray is safe for children and adults. For babies, drops are usually better. Saline doesn't interact negatively with other medications. If you use it along with medicated nasal sprays, it should be used first. Otherwise, you risk rinsing the medication out of your nasal passages. How to take nasal saline spray. Follow the product instructions that come with your nasal spray. General guidelines are: you can be in an upright position. You don't need to tilt your head back. Gently blow your nose to clear your nostrils. Close one nostril by pressing your finger against it. Place the spray bottle under the other nostril. Aim away from the septum, the middle of your nose, so you don't damage it. Close your mouth. Inhale slightly while gently squeezing or pumping the spray bottle. The usual instructions are to apply 2 squeezes. Make your own. You can make own saline nasal spray from table salt and tap water. The simple recipe is to mix 1 teaspoon of salt, 1 quart of tap water. For safety, boil the salt water for 20 minutes. Then let it cool to lukewarm. Pat it into a clean squeeze bottle. Side effects. Side effects from saline nasal spray are rare. If you notice stinging, it may be due to preservatives. Recap. Saline nasal sprays can be used as often as needed. Effects don't last long. The preservatives sometimes cause stinging. If that happens, look for a preservative-free brand or use homemade spray.